A very good morning and welcome to Kusile Breakfast Show. Sibonga kakhulu ukuthi namhla ekseni nivuke nathi kungilesihlanu lesikhombisa kiyo inyanga yaBhimbidvwane. Kukhumbuta nje umbukeliko ukuthi kusukela evikini lelitako uhlelo Kusile Breakfast Show litawubuyela esikhatsini salo litawuqala ngensimbi yesithupha ekseni lideliye uphetha ngensimbi yesiphohlongo ekseni. Kusukela ke mhla ka-10 January sitawubuyela ku our normal duration. Kuphindze kukhumbuta ukuthi liyatfolakala khona ka YouTube. Asisibuke nangombikelo soka khona etiko letempilo. Kanti-ke elangeni layitolo kuhlolwe bantfu labangu 954 lokwatfolakala ukuthi labangu 148 banemkhuhlane i-COVID labasithupha basishile itolo emhlabeni kanti labasesibhedlela labelashwako bangu 100 lasabaluleme tinombolo letinsha bangu 428 ama-active cases wona emeku 2583 lasabagome ngalokuphelele bangu 301,699 bese kwakha 25.8% we total population. Sisabukwetona nje tindzaba temkhuhlane COVID-19 hulumende welive lase-France omemetele ukuthi sekutholakale luhlobo lolusha lomkhuhlane lelibitwa ngekuthi IHU. Kanti-ke ama-researchers athi lelu hlobo lolusha lutholakale kulenye indvodza lebeyivakashele eveni lase-Cameroon. Bavetile-ke bagcizelela ukuthi lehlobo lolusha akusho ukuthi li-originator khona eveni lase-Cameroon. Kanti-ke kubene kukhathateka lokuvelile kulandzela ukuthi masinyane kutabe kubanjwa ema-AFCON Games khona eveni lase-Cameroon. Ma-researchers kuyabukela ukuthi mangabe sekutawuvela tinhlobo letinsha talomkhuhlane kumele ukuthi kube netinyathelo letithathwako nekuvikela kwanza kwalomkhuhlane. Kanti sesibuka letisuka eveni laseMelika CBS kanye lamanye ama-organizers sebamemetele ukuthi luhlelo olukhulu emhlabeni ama-Grammy Awards angeke asabanjwa mhla ka-31 January njengoba bekumele abanjwe khona eveni laseMelika e-LA ngekubuka ukuthi itinombolo tabantu labatfola lo mkhuhlane setenyuke kakhulu eMelika kuleli viki nje kutholakala ukuthi ngelanga linye bamhla bangetulu kwesigidi batfolakala ukuthi banalihlobo lolusha i-Omicron variant. Ama-organizers ke yabuka ukuthi kutawubeka impilo tabantu engodini ukuthi kube nawo ibe khona le show. Kanti nomhla ehlelweni sidaba sinifakela lapha sindlalela iclip ya WHO umcondzisi jikelele wayo inhlangano we-WHO Dr. Tedros kusiniketa nje the latest update on i-COVID-19 kanye ne-vaccination. Asibahlele emakethe sidabene netindzaba.
Your TV license quickly and easily with MTN Momo. Simply dial *007 *3# and select option 8 for TV license. Enter your national ID number as your reference and the amount you wish to pay. Then enter your PIN to confirm your payment. Once your payment has been made, you'll receive a confirmation SMS of your payment. If you're a first-time payer, you get another SMS for your TV license. So legalize your entertainment from the comfort of your home. Pay your TV license the easy and convenient way with MTN Momo.
Everywhere you go, MTN.
I do the most.
Watch local TV on the go with the Eswatini TV app for only 20 emalangeni per month. Do the most with Eswatini TV app. Download from Google Play Store or App Store.
We're good together. Everywhere you go, MTN.
Asiphinze sinimukele ihlelweni Kusile Breakfast Show sitawungena etindzabeni tetfu. Inhloso yekukhutsata kongiwa kwelutfutfasi lolulinyatwa kwanza kwetimoto letikhipha intfutfu pheceleti ema-gases langcolile lalimata lona lutfutfasi nekukhutsata kuncipha kwetimoto emgwacweni pheceleti traffic. Indvuna yetemafa Neil Rickenberg nebaphatsi betinkapane letehlukene lokufaka ekhatsi emabhange nemadolobha bagibele ibhasi lesuka kaManzini leya eMbabane ngenhloso yekuva imphilo nebudlela sive lesikhatsateka ngayo imihla nemalanga.
Ngenhloso ikhutsata kongiwa kwelutfutfasi loselubulawa kwanza kwama-gases langcolile lakhokhwa ngito timoto nekukhutsata kugibelwa kwetimoto etfwala sive kunciphe itraffic emgwacweni njengoba labanengi sebanato timoto. Indvuna yetemafa Neil Rickenberg nebaphatsi bemabhange loku-Standard Bank ne-Building Society nemphatsi welidolobha lakaManzini Lungile Dlamini nemcondzisi wenkampani i-Far East Garments Tokeho umphatsi webhizinisi Eswatini nathi Dlamini nasihlalo welibandla letimoto etfwala sive sihlangu Nhlabathi nalabanye bagibele ibhasi lesuka esiteshini semabhasi kaManzini le eMbabane bashiya timotolo tabo batimbandzakanya nesive. Bachube bemabhasi bakuthokoteleke kuyibona indvuna igibela ibhasi bayivusela kanzi kufuthwa ngama-sanitizer bagibeli bangakagibeli kuhanjiswa imbili-ke kaManzini. Ngekhathi ebhasini kube lithuba lekuthenga loko lokuthengiswa bosomabhizinisi abancane babasekele. Indvuna nabo-ke baphansi lebo-CEO babhadele njengawo wonke logibele. Indvuna-ke yakukhutsata kuhle ukugibela imoto layisha sive noma-ke imotolo unayo ngoba kwanza kwato kakulungele inani lutfutfasi.
The public transport is a safe, is a healthy, and is a very environmentally friendly way of people moving around. And so hence the experience today is just to promote that, trying to promote the taxi and the bus industry and trying to give it the support that we can to be able to say that the country supports that industry and really hopes the best for the industry. We're trying to do a few things as a government to try to make sure that the public transport industry continues to thrive and continues to grow in the country. But you are correct. Carbon emissions is becoming a bigger and bigger issue in the world. And as Eswatini, we also need to be cognizant of that and be able to say, listen, what can we do to reduce carbon emissions? And using public transport, even if you have transport, is a very good idea. And today, the experience I've had on the bus is really an amazing experience.
Rickenberg uthi uluthokotele loluhambo kanzi uthi bese kusikhathi yagcina kuhamba ngemoto lelayisha sive kodwa ke naka ngaphandle kwaleli uyayisebenzisa. Sihlalo welibandla letimoto etthwala sive sihlangu Nhlabathi ukhumbute sive ngemithetho yemkhuhlane i-COVID-19 nawusesiveni.
Kukhona kuwini order and siyababonga bakazulukhala mfakwenda lokho. Lokunye ke lokungumthetho. Umthetho uthi maski wayingena ebhasini wayikhumula. 800 emalangeni. Lokuna umbhadale wena mgibeli. Ambhadale nengathi wemoto. Nokuthi ufake imask akusiko lokwenda nje. Uthi ufake imask. Ufake imask kuyifaka kanje uvalele ikhala.
Nathi Dlamini webhizinisi Eswatini yena-ke bekabuta sive imibuto mayelana nalomkhuhlane akuhlomelisa tipho kulabaphendvula kahle lekutipho etiqhamuka enkampanini i-Far East Garments. Umuntu lomushaka lobekahlele liceleni kwendvuna uthi vele amkhulu waseke uyalisebenzisa lelithuba liqela indvuna ukuthi engathi emaphakelo ensha angathi caca ku-budget speech yalonyaka. Etindzabeni ngingiyani Msibi ngaManzini.
Litiko letemphilo ehlangothini lekwatisa sive ngetemphilo litawuchubeka nemikhankaso yekukhutsata emaswati ukuthi agomele umkhuhlane COVID-19. Ngekusho kwalobuketi inhlangothi lekwatisa Dr. Abongiwe Malinga uthi litiko litawuchubeka nekubambisana netinhlangothi letifaka ekhatsi emabandla, tikolwa kanye nemabhizinisi.
Noma live la Kangwane seline bantfu labang 300,000 lese bagome ngalokuphelele kuvikela umkhuhlane iCovid-19 kepha ke solo lisemuva emgomeni wakamhlaba njengoba ke uthi kulomnyaka lophelile sive bekubheke ukuthi sifike ku 400,000 kulomnyaka lofile. Lobukete kwatisa ngetemphilo Dr. Abongiwe Malinga uthi litiko letemphilo linemikhankaso letawuchubeka kukhutsata sive ukuthi sigomele lo mkhuhlane.
Sisachubeka nemikhankaso leminengi lekhutsata sive ukuthi siphume sijove. Sisachubeka nato tinhlelo tethu lebezivele sinato bezivele sijova kuma clinics ethu siyachubeka besinayo futhi i-team lephuma ko emangweni kuma communities laphansi kwetinkundla nakhona lapho futhi solo siyachubeka. Solo siyachubeka futhi nalaba be private sector lesingathi balapha etindzaweni tekuthengwa boma shopping malls nakhona solo sikhona. solo siyachubeka. Siphindze futhi sisebenzisana nalaba bemasondlo. Siyakhona ku-invite siye emasondweni sitojova sive lesikhombisa kuba nemdlandla wekujova. Sisebenzisana nalaba labasetikweni ngathini sports fraternity. Nabo labo siyasebenza nabo. Siphindze futhi sichubeke masinyane sidabe sisukela tikolwa ezisivulwa tikolwa solo yonke leyo mitamo leyo imitamo yalo litiko ukuthi litfole wonke lodzinga ukuthi ajove.
Sikhulumisene nesive kutfola ukuthi yini le yenta eMaswati ukuthi asimbatheke ekuthenini agomele lo mkhuhlane.
Sinema-cultures lehlukene, sinetinkolelo letehlukene, so kulo nje lokwenda ukuthi labanye abantu bangafuni ukuyojova, labanye batshela ukuthi i-COVID into yaka-satanism, lo mjovo ezowujovako utawujova awunolasta boma 2 years. So tiningi letinto lesibhaliwe nge-COVID, so kube kuya ngawe ungumuntu wena as individual ukuthi ucabanga yini lo ifuna kuyenda.
Lo naloyo muntu uba nelicembe lokuzivikela nje bese lishoba ukuziphungela ngeke ngesathi jova ngengane kodwa kwala kade uthi sola khona umuntu usewu mama ningathi bambelela ngeke sekungasathola kanje kusho live kusewu lapho nafika isikhathi uthiwa la uNkulunkulu usene kumpitha tuta sesingekho lesikhathi uyawube uyatsisola useyakubhaqaba ungako ngithi no Maswati akajova angathathi imiva yebani ngoba umuntu naye utivikela yena ufuna kube nebakakhe abantu abo sibangamsida.
Dokotela Malinga uthi sive asigome njengoba lesigaba sesine semkhuhlane sitawulandzelwa sigaba sesihlanu.
Siyathi ukuthi labo fourth wave lesisanza kuphuma kubo noma kumbe lesisakaphumi kahle kubo sisakaphephi noma bangehla kwamanje kodwa kusenelithuba lekuthi kungachamuka fifth wave. So siyafuna vele ukuthi sive sonke sibe kulesi covered sibe kulesi jovile khona sitawuvikeleka noma kungachamuka fifth wave noma kungachamuka ivariant lenjani sonke sibe kulesivikelekile. So usamkhulu umsebenzi kodwa silitiko sijabula kakhulu ukuthi vele siyakhona kwenda lokho.
Live leSwatini ke liku 25.8% webantfu lesebagome ngalokuphelele. Etindzabeni kubika Sondomlangeni eMbabane.
Mengameli we-League of Churches uMbishop Samson Hlatshwago seweluleke waphindze wexwayisa sive sonke lesithandaza enthabeni kuthi akungendeki umuntu ahambe yedwa uma aya kuyothandaza. Hlatshwago kusho lokhu kulandzela sigameko lapho khona umndeni wakaKhumalo wasemahwabayini eshiselweni uke walahlekelwa intombatana yawo lebeyihambe yodwa iyothandaza enthabeni.
Mengameli we-League of Churches uMbishop Samson Hlatshwago sowubongele umndeni wakaKhumalo ngekutfolakala kwemfana wabo Kusile Msibi lobekanyamalele ekhaya emalanga lasikhombisa kulandzela ukuthi ahambe athi uyakuyawuthandaza etintsabeni. uMbishop Hlatshwago uphindze weluleka sive ukuthi singayi emini kuyothandazela etintsabeni kodwa siye ekuseni njengoba timvula tinelulaka kulamalanga.
Mfana ngonyama kokuqala nje ukuthi asiboke lokuthi atholakale wamsibi aphile ngoba imvamisa bavama ukutholakala umlanga lahleka atholakala asafika. Siboke uNkulunkulu nje lokuthi amgcine wamsibi akhona lesigabeni. Yebo endzabeni lapho khona sithandaza khona nawambambe sizilo nje uthandaza endzabeni. Kepha ngisasho njalo nalendzabeni kulamalanga akulungi ukuthi uye emini kufuneka uye kusesekuseni nothandaza kusesekuseni ngoba lelitulu selibi liduma kabi lalendzabeni vele ngavama kulimala kufuna ukuthi lingeva nje liduma kanje bese vele ngehle ngiyabeni kona vele kuyathikeka ukuthi sithandazele leli zemfalweni ngonyama umthandazo lomkhulu ke ngilesizilo nalokukhuphuke tindzabeni. Kepha siyacela nje naye wamsibi akulakaya le endzabeni nangabe khona ukuthi uNkulunkulu yamthuba angahambi yedwa kube khona latawuhamba nabo ngoba ngeke kuvale kahle ukuthi kuvakale kahle ukuthi ukhuphuka kwethu yothandaza endzabeni angeke kuvakale lasekuvelelwa ingoti endzabeni kunetilwane nase ulinyatwa tilwane ungathiwa lothi udliwe isilwane sekudla ukuphi unabantu kanti lakhona labanye bathi awusosilimalele besila. Siyanxusa nje ukuthi bazalwane nabayendzabeni bangabohamba ngamunye babokhulu abalidlazanyana.
Khombisile wanyamalala ekhaya ngalesihlanu ngetithuba tensimbi ye-11 ekuseni. Lokhu yasatfolakala ngelisontfo asalibangise ekhaya achamuka etindzabeni tasengololweni. Etindzabeni te-Eswatini TV kubika Sifiso Nxumalo nginesimuva shongwe sisemawabayini.
Libandla lelibukete kutfutsa etiko letemsebenti lemikhulu nekutfutsa lisemkhankasweni walo wokukhulumisana nenkampani emaposi netincingo kutsi sive sikhone ukutfola ema-license plates etimotolo nasesibhadele ngahamba mali. Ngekusho kwelisekela lemcondzisi waloluhlangothi Muzi Maphanga, loku kwentelwa kutsi sive singahambi indzawo lenze kuyobhadala imali yemthelo njengoba sekubonakele kutsi sive siyaluthakasela lolu hlelo lokubhadalela umthelo ngahamba mali.
Hulumende wasukumisa luhlelo lokubhadala imithelo yetimotolo ngahamba mali ngenhloso yokunciphisa emalayini. Lisekela lemcondzisi welihlangothi lotekutfutsa Muzi Maphanga lithi solo lacala kusebenta loluhlelo sive sikhombisa inshisekelo lenkhulu kulisebentisa.
Maswati ayasithakasela kubhadala ngaleto tincingo ngahlala ekhukhwini. Lokho kuphela utakhumbula ukuthi sekwentela ukuthi lo msebenzi ube lula. Njengoba esikhathini lesiningi ukhanza ukuthi vele njengoba ushito ukuthi amalayini abamathe kakhulu laphayana etindzaweni tekubhadala takahulumende kuma-revenue offices. Bantu bakhanze sebahlala ilanga lonke khona. Nyalo nje ukuthi nathi uyayifuqa leyo mali sikakhona kuyongena ngekhathi. Sikhanze ukuthi abantu bakuthakasela ngaloko ukuthi naleyo express till noma lapho sithe thina khona balandele diski bantu vele bakhanza ukuthi bayasitakala masinyana bese bayayithola leyo disk. Le mishina lena lemikhulu lesisebenzisako isebenzisa i-network yona lena yetincingo lokuhle kwendeka nje mhlambe iphatamiseke ngokwelitulu ihle iphatamiseka ngokuthi njalo imishini ebelumbi ihle iganga sencele kodwa ke siyabonga lokho ukuthi njalo nje nangabe sokungasasebenzi ngaleso sikhathi siyazama ukuveta lapha etincingweni ukuthi nyalo iservice noma lusito alitholakala lesikhashanyana. Nekusho ke bekunene ukuthi lapha ekugcineni sibonile ukuthi sive sisawalandza lamadiski lama-licenses sebabhadele. Kube sekuba nebulukhuni ukuthi sengidahophenze ngihambe ngetinyawo ngiyoshona lena kwe-revenue ngiyolandza yini ngingayitholi idudana. Hulumende ke ubese uyabona ukuthi asala agcwalisa tikhala ngokuthi angene Eswatini Post and Telecoms i-PTC lotawuthi ke yena nanaye adlale inzima kahle ngokuthi ulandze leyo disk yakho unasowubhadele lapha eposini lesedutane nawo.
Sive lesifuna kusebentisa loluhlelo lolulula futhi lolithatha isikhathi lesincane singasebentisa bomahlalo ekhikhini sifacade *468# bese ke silandzela leyo milayito letawuvela. Lolu hlelo lolu luhambisana neluhlaka lwentfutfuko lolwasukunyiswa nguhulumende eminyakeni wa 2019 kuthi ke eMaswati atfola lusito lolusezingeni elisetulu futhi ke ngekushesha. Etindzabeni kubika Sondomlangeni eMbabane.
Libhange lengadi solo libhekene nenkinga lenkulu yekweswelakala kwengadi. Ngekusho kwaNhlanhla Nhlengethwa longunesi kulelibhange usina kuvula tikolwa kanye netinkampani batawuchubeka nekukoleka ingadi. Nhlengethwa bayakhulumana kachaza ngemkhankaso wokukoleka ingadi kulomnyaka.
Ngemetamo yekukoleka ingadi letsingwa sive lesesimeni lesibucayi, libhange lengadi litawuchubeka nekukoleka ingadi yetikolweni. Ngekusho kwanesi walelibhange, netinkampani nato tikhombisa kulibambisa lelibhange.
Ingadi lenengicishe siyithola la etikolweni vele nasihamba bayasinikelela abantwana nabotishela bayasita kakhulu ukuthi sibanikelise abantwana, so siyethemba lokuthi kumbe simo sitawuba ngcono kakhulu ezitikolo tivulwa sikhona nathi ukuthi siye sibanikelise. Lokunye ke netinkampani ke letiningi vele kade tavalwa nato lebe tisinikelela nato ke tiyavula kuleli viki letako kusukela ngomhla ka-10 nje bavula, so labaningi vele ke bahamba vele sesibekile emaphoyinti ukuthi nababuya siyacala siyabanikelisa.
Ngekusho kwemchumanisi wesive nemaphoyisa aphindile Vilakati, imibiko yebantfu labadzinge ingadi ikhombise kwenyuka ikakhulu kulamaholide lesibuya kuwo.
Bakhona ke nalabanengana labanato titfubulela ekushayana netekugwazana kakhulu kati kuto tindzawo tekujabula. Sisayikweleka ke leyo mibiko nakhona siyathemba ukuthi sitawubathola labo labende lokho. Solo siyagcizelela even indzaba yekujabula noma indzawo yekujabula ayibe nje yenjabulo, kungabe sekuba nemphefumulo lolahlekako noma umuntu losalimala kuleto tindzawo. Siyabonga.
Libe libhangele ingadi bathi bantfu labadzinge ingadi kula maholide basitakele.
Lebe sivamisa kokwenta ngokuthi vele sibacele ihlobo talabo labathintekako ukuthi bamane basinikele nathi-ke labanye abantu benkosi nje labadutana besibathinta ukuthi bete batonikela loko labanye bebasho ukuthi bakhashanyana basemakhaya kumbe batawuze babuye emva kwamalanga, kepha-ke besizama lokuthi vele kube khona lesibathintako ukuthi bete batosinikelele.
Nhlengethwa uthi ama-platelets wona asesimeni lesikahle etindzabeni kubika Sondomlangeni eMbabane.
Takamuti tendzawo yaseluwaweni ngaphansi kwenkundla yaseligongolweni setidumisa umsebenzi wahulumende ngokubambisana nenhlangothi lwakhe lokuthuthukisa imimango lokwa microprojects esakhiweni sesikole asemabanga laphansi. Lesive sithi bafundzi bahamba yema-hour alinganiselwa kulamabili kude bafike esikolweni lesifudane nabo sakumathetha.
Sive saseluwaweni indzawo lengaphansi kwenkundla yaseligongolweni sibonga hulumende ngekubabambisa ekwakheni isikolo semabanga lamancane. Kungmanje kwakhiwa tindlu tabothishela letimbili, tindlu tangasense letilishumi kanye netindlu tekufundzela letintsatfu. Lesive sithi lesikolo abevele kuyintfo lebekadze bayifisile kulendzawo kulandzela ukuthi tikhashane kakhulu tikolo labaya kuto bantfwana bakulendzawo lekwenta ukuthi bafike esikolweni sebakhathele.
Lesikole lesi bantfwana labahlala la bebahamba 2 ema-hour kuya esikolweni 2 ema-hour kubuya esikolweni. Kukhashane kakhulu umntwana lomncane leyaka grade 1 bekuyinkinga nje impela ngabe saba naso kadzeni kube bekuya ngathi kodwa ke ngokuthi yonke into ethamba ngetindlela takhona sigcine sesithole. Siyabonga kuNkulunkulu, siyabonga inkosi yethu, siyabonga nakuphakathi wethu, siyabonga ne7 ukuthi lisibambise kuze sibe khona lesikolo.
Lokushothi ke vele besine challenge especially la migwaqweni ngeminyaka nje bowati ukuthi bantwana labaya kulaba sithupha kulaba batawushayiswa timoto kulomnyaka ophelele nje saba nathula bashiye emhlabeni. Lendzawo labantwana labanye basuka le ngomangongongwane lokushothi it's about lo 8 nje sikhulumela kusuka la nasubala kusuka le ka Hotendasi kuya ku10 nabo bafuna bayele kubonazareni bafuna bayele bebefika sebadziniwe labanye bakhanzetha basakhona lokuya sebayahlala nje lamgwaqweni ngalendlela yinze. So siyambonga nje kakhulu hulumende
isho lokukhulu yetimpilweni tethu sisive sakulendzawo ngoba sibuka ukuthi isikolo sita nentuthuko kakhulu njengoba sekutabana lesikolo nje la nestation lesikhashane sesinalo lithemba lokuthi sitawukhona nemakhumbi kungena atojika etela esikoleni kulese mathishela nekusita abantwana nalesive sesiyasitakala ukuthi sekudosakala intuthuko yetakuso nabo batawukhona nokuthi mhlawumbe bangabeka naloko bathi makethele lababo make bathola nabo kuphila nekuthi nje ke labantwana bethu sebatawufunza kube dudane.
Labatali bathi banelethemba lokuthi kutawuthi kuvulwa tikolo kuleminyaka losetulu babe sebacala abafundzi belibanga la grade 1 kufunza kulesikolo saseluwaweni. Umbiko uhlanganiswe ngithembe lihle magutsho tithombe ngithemba shabanguye luwaweni.
Ijaha lelineminyaka leli-15 licwilile emfuleni ingwemphisi emini ngalesithathu. Leli jaha kusolakala ukuthi belibhukusha nebangani balo.
Bangani basisho sibanze wasengwempisi solo basemangele kulandzela ukuthi umngani wabo anyamalale emandini kusabhukushwa kumnanzi ngalesithathu. Babeseke bahlaba inyanzeleyo kwaba kuphuma kwetakhamuti timfuna kulandzela ukuthi acwile basabhukusha. Nangalesineke kuchubekile kumfuna kwesive lebe sesineti inhlambi temaphoyisa lenato tikhiphe lwati lwato letimfune tebuka nemfula nani kutholakala sisho. Babe wakheke uyasilanzisa ngekunyamalala kwemsa wakhe.
Kwakhala tinguku nakhala tinguku ngathi mfana mawubuke lapha ngathi kunenyoka besihlahleni ngathi ngibukele ngoba nemehloko asabuka wathi hayi babe kude ngabuyela lamahlala ngala uhlala ngala umuntu omdzala ke ngase ngiyatumeka ngiyalala ngalivulati yabona khona ukuthi dudu wathi nya sikhathi angathi lutho phela umntwana silakha sobabili athi ukuthi waqhamuka umnaba sakhala ibambe uphisisho kuthi intombatana sisho ugumukele kwaba ngiloko nje ngokufika yona.
Induna yenkundla ingwempisi Majangwenye nayo lebe yingcenye yesive lebesimfuna iyavelana nalomndeni.
Sithi nje sibhlungu kakhulu siyamlilela nemndeni wakasibanzi lohanjelwe ngilomntwana. Ngicabanga ukuthi inkosi itasiva itamkhipha lapho abeke khona manje simthole simgcwabe njengabo bonke abantu labangcwatshwayo Nkosi. Disemba nje kuhambela ababili bokutofika Christmas lona wesithathu. Lokusho kona ukuthi lo mfula uyingodi kakhulu. Singacela nje kuxwayisa eMaswati lokuthi kangasonzele mandini nakangaboni phasi.
Leli jala leminyaka leli-10 ifunza kulesinye setikolo etiphakeme esifundeni sakaManzini. Emaphoyisa nebelitiko letemcebo waphansi nemandla bachubeke njalo nekuxwayisa sive ngekuwela imifula nemadamu kugcwele ikakhulu lapho timvula titse citsisaka eveni. Nasahlanganisa lombiko bekusachubeka kufunwa kwakhe asengakatholakali. Etindzabeni ngingiyani Msibi ngisengwempisi.
Kutemidlalo, mapalane wenhlangano yemidlalo we-rugby kuleli Phumlani Gomeze uthi lo nyaka bafuna ukucala ngekucedzela luhlelo lwabo lokumikisa lo mdlalo emakhaya lebebalucala eminyakeni lophelile. Gomeze uthi bafise wonke umuntu ati ukuthi lo mdlalo ukhona lapha eveni.
Inhlangano yemidlalo we-rugby selokhu isebenta amadima ukuthi lo mdlalo wadiwe abantu labaningi eveni. Eminyakeni lophelile yaqala lihlelo lokuhambisa lo mdlalo etifundeni telive ifundisa ngalo mdlalo kulabo labangafisa kuwudlala. Le nhlangano nakhathaloku eminyakeni lophelile beyiphadamiswa ngomkhuhlane we-COVID-19 isilonyaka bathoqhubeka ngemandla. Mapalane wale nhlangano Phumlani Gomeze uthi bafuna wonke umuntu adinga lo mdlalo.
Lesigaba sokuqala seminyaka kulapho khona sibuke khona ukuthi sitawuqhubeka nemisebenzi yethu lebesiwenda etinkundleni kuma-communities lapho khona besi introduce i-rugby besifaka khona i-rugby kubantu emiphakathini sendela ukuthi inqumbi yabantu batawukhona kuthola noma batawukhona kubona i-rugby ikhona ipile kibo. Lokho sikwendisa ukuthi esikhathini esiningi kuya ekukhanzakala ukuthi abantu abati ukuthi ikhona i-rugby eSwatini. Bantu basengake bayibona i-rugby eSwatini. Sasa sesithi asithathe i-rugby siyimikise emiphakathini kubantu.
Gomeze uphethe ngekuveta ukuthi batokuya nasetikolweni lapho bafise ukuthi lo mdlalo uqale kudlalwa khona abantwana bakhule nawo. Lobikela umsakazo weSwatini TV temidlalo ngiphathizwe Msibi eMbabane.
Ngaleto temidlalo siyarephetha tindzaba tetfu asibohlele timakethe sidaba sichubeke nehlelo. Welcome back mbukeliso lobukela hlelo Kusile Breakfast Show sikuvusele nawe lo sanza kusivulela kulesikhathi sitawubuka yona latest updates lesuka khona ka WHO le yethulwa nguye umcondzisi jikelele wayo lenhlangano Dr. Tedros.
Happy New Year. The dawn of a new year offers an opportunity to renew our collective response to a shared threat. I hope global leaders who have shown such resolve in protecting their own populations will extend that resolve to make sure that the whole world is safe and protected. And this pandemic will not end until we do that. Last week, I asked everyone to make a New Year's resolution to get behind the campaign to vaccinate 70% of people in every country by the middle of 2022. And on top of that, to ensure that breakthroughs, treatments, as well as reliable tests are available in all countries. To end the acute stage of the pandemic, the highly effective tools science has given us need to be shared fairly and quickly with all countries of the world. Vaccine inequity and health inequity overall were the biggest failures of last year. While some countries have had enough personal protective equipment, tests, and vaccines to stockpile throughout this pandemic, many countries do not have enough to meet basic baseline needs or modest targets which no rich country would have been satisfied with. Vaccine inequity is a killer of people and jobs, and it undermines a global economic recovery. Alpha, Beta, Delta, Gamma, and Omicron reflect that in part because of low vaccination rates, we have created the perfect conditions for the emergence of virus variants. Last week, the highest number of COVID-19 cases were reported so far in the pandemic. And we know for certain that this is an underestimate of cases because reported numbers do not reflect the backlog of testing around the holidays, the number of positive self-tests not registered, and burdened surveillance systems that miss cases around the world. While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. Just like previous variants, Omicron is hospitalizing people and it's killing people. In fact, the tsunami of cases is so huge and quick that it is overwhelming health systems around the world. Hospitals are becoming overcrowded and understaffed, which further results in preventable deaths from not only COVID-19, but other diseases and injuries where patients cannot receive timely care. First-generation vaccines may not stop all infections and transmission, but they remain highly effective in reducing hospitalization and death from this virus. So, as well as vaccination, public health social measures, including the wearing of well-fitting masks, distancing, avoiding crowds, and improving and investing in ventilation are important for limiting transmission. At the current pace of vaccine rollout, 109 countries would miss out on fully vaccinating 70% of their populations by the start of July 2022. The essence of the disparity is that some countries are moving toward vaccinating citizens a fourth time, while others haven't even had enough regular supply to vaccinate their health workers and those at most risk. Booster after booster in a small number of countries will not end the pandemic while billions remain completely unprotected. But we can and must turn it around. In the short term, we can end the acute stage of this pandemic while preparing now for future ones. First, we must effectively share the vaccines that are being produced. Throughout most of 2021, this was not the case, but toward the end, supply increased. Now it's crucial that manufacturers and those donating countries share delivery timings ahead of time so that countries have adequate preparation to roll them out effectively. Second, let's take a never-again approach to pandemic preparedness and vaccine manufacturing so that as soon as the next generation of COVID-19 vaccines become available, they are produced equitably and countries don't have to beg for scarce resources. A few countries have provided a blueprint for how high-quality vaccines and other health tools can be mass-produced quickly and distributed effectively. And now we need to build on it. WHO will continue to invest in vaccine manufacturing hubs and work with any and all manufacturers who are willing to share know-how, technology, and licenses. I'm encouraged by some of the vaccines currently going through trial where innovators have already committed to waiving patents and sharing licenses, technology, and know-how. It reminds me of how Jonas Salk did not patent his polio vaccine and in doing so saved millions of children from the disease. Let's also invest and build the public health and health systems we need with strong surveillance, adequate testing, a strengthened, supported and protected health workforce, and an empowered, engaged and enabled global population. And finally, I call on citizens of the world, including civil society, scientists, business leaders, economists and teachers, to demand that governments and pharmaceutical companies to share health tools globally and bring an end to the death and destruction of this pandemic. We need vaccine equity, treatment equity, test equity, and health equity, and we need your voices to drive that change. Equity, equity, equity. No place is this message of equity more true than in countries or regions dealing with humanitarian crisis and conflict zones. In these areas, tackling the pandemic as well as keeping health services on track is extremely challenging. The base requirement for life-saving intervention is humanitarian access. And we are on the ground in every humanitarian crisis and in all instances have found ways to reach populations with aid and supplies. For example, in Afghanistan, until recently, over 3/4 of health facilities reported stockouts of essential medicines, and there was a threat to sustaining health workers in their posts. But as of December, over 2,300 health facilities had received new supplies, and 25,000 health workers have been paid, ensuring the functionality of 96% of the health system through a joint WHO-UNICEF effort, especially the Sahat Mandi program. In Ethiopia, WHO was able to dispatch 14 metric tons of medical supplies to Afar and 70 metric tons to Amhara in December. Two places have been affected by the conflict. In Tigray, WHO has not been permitted to deliver medical supplies since mid-July of last year. This is despite repeated requests from WHO to provide medical supplies to Tigray region, which would help meet some of the humanitarian and health needs in Tigray. Even in the toughest periods of conflict in Syria, South Sudan, Yemen, and others, WHO and partners have had access to save lives. However, in Tigray, the de facto blockade is preventing access to humanitarian supplies, which is killing people. At the top, I spoke of how the new year is a time to renew. I urge all leaders and key stakeholders in conflict to remember that those who work for peace are the heroes history remembers. We need health for peace and peace for health. To build trust and save lives, a good starting point is to ensure humanitarian and health corridors are open in all conflict zones so international agencies and civil society groups can do what they do best: save lives. And to those celebrating Orthodox Christmas tomorrow, may your homes be filled with peace, happiness, and good health.
My question is about what people should be doing given this rage of Omicron cases. Aside from getting vaccinated, if they haven't already, how can people change their behaviors to help prevent Omicron from spreading beyond what many people were already doing to help stop the other variants? For example, should people be double masking more, washing hands more regularly? Should they stop hugging? Should they spend even fewer moments in a confined space with other people? Or keep a distance while passing people for just milliseconds in the street? Is Omicron that contagious? In short, what more can individuals do to fight this highly transmissible new variant that is raging in so many places?
People can do so much. The power that people have in hands, thank you, the power that everyone has in their hands to be able to protect themselves and their loved ones has never been more important. What we have advised and what we are continuing to advise is to take a comprehensive approach in knowing what your risk is where you live and take measures to lower your risk to be exposed to this virus, and if you happen to be exposed to this virus, for the potential to pass it on to others. It is about making personal decisions and making decisions for you and your family, and also having the policies to support you in those decisions to be able to keep yourself safe. This is about distancing, keeping your distance from others outside of your immediate household, wearing of a well-fitting, appropriately made mask. Not all masks are the same that are out there. There are masks that are out there that are better than others. We make recommendations on the minimum standards of masks in terms of layers, in terms of the way that they are constructed. There are standards that are out there. So get a hold of a well-fitting mask and well-made mask. And please make sure you wear it appropriately. I've spent a couple of days outside of the office during this holiday period, and I'm struck by how people actually are wearing masks. When you put a mask on your face, you need to have clean hands. It needs to cover your nose and your mouth. Wearing a mask below your nose, wearing a mask off of your ear, wearing a mask below your chin is useless. And it gives you a false sense of security that you have something on that is protecting you. It will not. It needs to be well fitted over your nose and your mouth. It's about making sure that you spend more time in places where there's better ventilation, either outdoors or inside where there's better ventilation. It's about businesses, workplaces, schools, governments investing in good ventilation. That takes investment, it takes time, but this is a good investment not only for COVID-19, but for other contaminants that are out there. And it's about making choices, about limiting your contacts with others, avoiding crowded spaces. These are really important right now. But we also need to make sure that there are national policies that support you in doing this. Staying home if you're unwell, making sure that there's good testing facilities that are out there and that people have access to reliable tests so that they know if they are infected, and if they are infected to get into the clinical care pathway early, because early clinical care saves lives. To isolate and make sure that you don't pass the virus onto someone else. Alerting your contacts if you are a confirmed case. Letting your contacts know that they need to quarantine so that they, if they happen to be infected, that they don't pass the virus on to others. Basically, we are asking everyone to play a part in this. We are asking governments to have rational, evidence-based, tailored, comprehensive policies with a layered approach of all of these different types of interventions that keep people safe. Essentially, do it better. Do everything that we have been advising better, more comprehensively, more purposefully. We will not be in this situation forever. Your question was around Omicron and this wave that we are seeing right now. And it is really quite astonishing how well this virus spreads. But this variant with the properties that it has and the increased transmissibility it has, it's also in the context of immune evasion, so people can be reinfected. It's also in the context of people mixing without measures in place. Any variant will thrive in that situation. So we need everybody to play their part and really focus on what you can do to keep yourself safe. So, thank you very much for the question. Just please be purposeful in what you are doing. Take the steps to lower your exposure to this virus. And again, keep in mind that all pandemics end. This pandemic will end as well. We need, as the Director General said, to ensure equity to tests, to therapeutics, to vaccines. And as individuals, you can fight for that as well. So please get vaccinated when it's your turn, and please follow the public health and social measures that can keep you and your loved ones safe.
Omicron is more transmissible, but it's a relative increase in transmissibility. If we look at the secondary attack rate studies that have been done in the UK and in South Africa, I think in the United Kingdom we're talking somewhere between 10 and 16% further transmission within households. In South Africa it was slightly higher, and that may reflect the size of households in that situation. But certainly the increase in risk of transmission with Omicron in that setting was twice as high. So, for example, in the UK studies, I think it went from about 10% risk of transmission to 15% risk of transmission. In South Africa, similar. Also, people who have been fully vaccinated had a much lower risk of having a secondary transmission in their household. So there's lots we can do. Get vaccinated, recognize that the household is a place where you can reduce the risk of transmission, and many people have done that successfully by ensuring that if you're sick, if you're symptomatic, self-isolating until you're tested, until you get a diagnosis. If you're a contact, going by the national guidelines for your quarantine periods, and also be aware of the context that a lot of transmission, and we've all heard anecdotal reports, but there are a number of reports of large-scale transmission, in particular indoor crowded settings. And again, so it's the same basic things that Maria has said. It's knowing your risk. It's recognizing that Omicron is more transmissible. So the chances of you getting the virus in the same situation is higher now than it was before. But it's exactly the same behaviors that will protect you. You just need to do them more assiduously, more often, and you need to be more careful about where you go, how long you spend, where you spend your time, and how you protect yourself. There are no easy answers, but that's and it's a good message, and thank you for asking the question, Jamie. It's important that we get the opportunity to communicate with people around what will protect them, and it is exactly what protected people before. But I would say, and I'm sure everyone at this table would say, one of the best protections is to get vaccinated. If you're offered a vaccine, please take the vaccine.
I received some information that I kindly asked to WHO to confirm or clarify about the discovery in southern France by the Mediterranean Institute of Infection at the University Hospital Center about the new variant of COVID-19. Is it true? France said that already resisted 12 cases of this variant. And if it's true, I ask, the vaccines that are being administered protect people from these mutations? Thank you.
So this vaccine, this variant that you're asking, it's this B1640. The earliest detection of this variant was detected in September 2020 in a number of countries. And there was a preprint that was published coming from our researchers in France recently. This variant has been discussed with our technical advisory group on virus evolution, and it was characterized as a variant under monitoring in November 2020. And this variant does have a large number of mutations. Our understanding, it's not very well circulating. Within France, less than 1% of the samples that were sequenced in France are of this particular variant. There's two sublineages of it, the B1640.1 and the B1640.2. We classify both of those as a variant under monitoring. And this means that it's important that we track this. particularly because of the numbers of mutations that it has. But it isn't circulating widely at the moment. And the reason we classify it as a variant under monitoring is to raise awareness and for people to be on the lookout for that. So as more sequencing is done, and we thank governments and countries and researchers who have worked so hard to improve sequencing around the world, it's important that those sequences are shared on platforms like GISAID. And we should say in the month of December, more than 1 million sequences were shared with GISAID. That is unprecedented. And we need more of that to continue because that helps us track. So this is a variant that we are considering under monitoring. And if that were to change or if that changes, we will be certain to let you know. But it is not uncommon for research to be done and for those preprints to come out and that information is shared with us. So it is really important. I do want to just highlight, and Kate will probably comment on the vaccines, but I just want to make the point that the vaccines that are available for COVID-19 work against all variants that are circulating, all of the viruses, the SARS-CoV-2 viruses that are circulating, and they are highly effective against preventing severe disease and death. And I think that's really important for the public to know. And as has been said many times, when it is your turn, get vaccinated because it's really critical. Vaccines save lives.
Perhaps I'll just add a couple of comments on the issue of this particular variant and the vaccines. As Maria described, not a variant that is increasing in prevalence, a small fraction of the strains that are circulating. And so the specific details on the performance of the vaccines, specific scientific evidence on the performance against this particular variant is still a matter to be evaluated. But the really important point here, as Maria said, and I'll just reinforce, is that the real intent, the priority for vaccine programs is the protection against severe disease, hospitalization, and death. And even with the Omicron variant, where we've seen substantial reductions in neutralization of the virus, the vaccines are still performing against that severe end of the disease spectrum. So we don't have an expectation that these vaccines would have reduced performance or compromised performance against the variant. But again, a minor circulating strain, and really it's a matter still of evaluation.
Dr. Abdi Mohammed, the WHO Incident Manager, mentioned at the UN press briefing on Tuesday the Omicron variant had mostly spread to countries that use the best-known vaccines. But there was no indication that other vaccines such as Sinovac or Sinopharm were not effective against the variant. So could WHO provide any specific statistics on the efficacy of the vaccines, particularly Sinovac or Sinopharm against Omicron or Delta variant? Or could you please describe the role of the two Chinese vaccines within the COVAX strategy, like the usage coverage in terms of the numbers of countries or populations outside China via the distribution of COVAX? Thank you.
We're monitoring extremely carefully the evidence on the performance of the vaccines against Omicron, again specifically the primary interest in having vaccines that are protecting against the severe end of the disease spectrum. And since the Omicron issue has started, we've really been emphasizing that it does take time for this evidence to accrue. We now have 9 studies on the performance of vaccines, but many, many more studies on the laboratory performance of vaccines, in other words, the sera of individuals who have been vaccinated and the ability of those sera to neutralize the replication of the vaccine, of the virus, excuse me. We don't have any studies specifically on the 2 inactivated vaccines, Sinopharm and Sinovac, on their clinical performance, but there is some evidence on the neutralization activity. And like all vaccines, there is a substantial reduction in neutralization, but what we're really interested in is the clinical performance of the vaccines. I think the other really important thing to mention is that we also have evidence about the mixing and matching of vaccines, that now we know a lot more about when you have one dose from one product and another dose from another product, that in some of those combinations there can be better performance than, frankly, if you get the same product. So still early days for the 2 inactivated vaccines, and we would very much like to have a set of effectiveness data, clinical data on the performance of these vaccines, especially for the protection against that hospitalization end of the disease spectrum. These are really important vaccines for the global supply and have been, demonstrated their effectiveness outside the context of Omicron. So we really would like to have that evidence and are watching very carefully for that to come forward.
I think first, thanks, Zinhua, for the question. The first point I make is, and it relates to one of the earlier ones that are made, when we think about vaccines and coronavirus, what we're learning is we shouldn't be thinking, does a vaccine work, yes or no? It's how well does a vaccine work? Because what we're seeing is all of these vaccines are doing what we need them to do, which is to save lives, prevent severe disease, hospitalization, take the pressure off the ICUs. As Kate highlighted, we have more data for some vaccines than we do for others, and we have to be very careful that we don't think an absence of data is an absence of impact. So let's be careful about that. And, Mike made the comment some months ago that the best vaccine you can get is the one that you can get the soonest. And that remains the case today, right? Get that initial protection in place. You can always boost, as Kate alluded to, with a heterologous boost and further boost the impact of these vaccines if needed. But the key thing is get that initial dose. And then in terms of the question about the use of the vaccine, through COVAX, we've shipped it to 49 countries, either the Sinovac or Sinopharm vaccine, and about over 180 million doses now, which is nearly 20% of the total vaccines that have been shipped through COVAX. So this has been an important part, as Kate alluded to, of the overall rollout of products around the world to try and boost immunity, save lives, and get in front of this pandemic. So important products, still learning about these products like we are about all products as we go forward. The other thing we need to remember as well, the virus continues to evolve, right? And these variants continue to evolve, and how it operates against one, as we're learning, may be different against others. So right now, we want to take advantage of the full armamentarium of vaccines that we have.
All right, it's 2 minutes before 8 o'clock. Sita vala lapho ke update lesoka khona ka WHO ukhulumile lapha Dr. Tedros asiniketa the latest update ngawo umkhuhlane COVID-19 kanye ke nayo i-vaccination process. Sibonga kakhulu ukuthi nibe nathi namhla ekseni. Sithemba ukuthi nibane imphela somvo lenhle nalebusisekile kunkhumbuta nje ukuthi kusukela next week ihlelo liyabuyela esikhathini salo lesinomali litawuqala ngensimbi yesithupha from 6 a.m. to 8 o'clock in the morning. Nitsale kahle, have a lovely weekend.